morning, everybody. My name's Nick Kelly. I'm the External Affairs and Parliamentary Manager at Hourglass Safer Aging. This morning's webinar is on data, and we're called Who's Counting Data webinar. Data is perhaps not always seen as the most exciting of topics, but actually it's incredibly vital, certainly from a policy point of view. If we don't have the information, we really policymakers can't make the right decisions. And this is a challenge not just in our sector, but we know actually across government there are a lot of issues with data gaps or incomplete data. But certainly for us, as you'll hear this morning, there are some real challenges that we need to overcome. So we're lucky enough to have two speakers this morning. We've got Danny from our policy team and Anastasia from the Vision Project. So I'll ask them both to introduce themselves, starting with Danny. Can you introduce your role and what your interactions have been with this topic?
Good morning, everyone. I'm Danny Tatlow, the Research and Policy Officer at Hourglass. I've been with Hourglass for around about 5 years now. I started at Hourglass when it was Action on Elder Abuse. Originally focused purely on research, but then my role branched into a policy role too. I deal with data in my day-to-day at Hourglass. Around statistics, both qualitative and quantitative data use in order to feed into policy and research.
Great. And Anastasia, can you tell us about the Vision Project and what your role is in that?
Sure, thanks. Morning, everyone. My name is Anastasia Fadiyeva. So I'm a research fellow at working full-time for the Vision project, as Nick said. So Vision stands for Violence, Health and Society Consortium. I'm based at City University of London. So in the Vision, one of the main goals is to measure violence and abuse, and we do it by using data from surveys such as crime survey for England and Wales, for example. We also use data from administrative settings, from healthcare, from the police, from third sector. And we look at violence and abuse in different population groups, but my specialty is like violence and abuse against older people. So I'm specifically looking at this. And for that, I use data from health services, from surveys such as English Longitudinal Study of Aging and Crime Survey, and from like UK Biobank data.
Brilliant, thank you. So just to our participants this morning, or to our audience, if you have any questions, can you please put them in the chat? So I'm going to be asking our panelists 5 fairly broad questions. Then after that, we kind of want to open it up to get your views and kind of get some questions from the floor, as it were. So the first question I have for both of you, and Anastasia, I'll ask you to answer it first. Why do you think older people have traditionally been excluded from data sets?
Sure. So it's a good question. So yeah, indeed, from many sources we use, such as crime survey for England and Wales, for example, older people over the age of like 74 have been excluded from the self-completion part for many years, and only this year they've been included in the self-completion part. I think partially the reason is assumption that older people are less likely to experience violence and abuse. So for that reason, for example, they might have been excluded from surveys and even from some administrative data in a way that they're not being asked about violence as much. For surveys as well, especially surveys that are being distributed online, such as self-completion, there is also like kind of a bit of an ageism as well, I guess, assumption that older people might not be as good in completing online forms, online surveys, and that's been also kind of questioned by other. So for people, for example, I work with in the Violence Society Center, they already know that's not necessarily the case, but that's the reason, like assumption why the digital surveys were not distributed to older people. And again, as I said, also for administrative data, the reason why we might not see so much cases of like violence in older people recorded, because by people who collect this data, such as health and social care professionals, they also have there's a misunderstanding that older people are less likely or wouldn't less likely to experience violence, and they're less likely to be asked for it. So again, there is a lack of recording, a lack of data on that.
Thank you. And Danny, why do you think it's been traditionally excluded?
Yeah, Anastasia summed it up really well. I mean, fundamentally, although there are a range of factors, it comes down to a limited understanding of the variety of experiences of especially older people that suffer from abuse and violence. And yeah, as Anastasia said, there is a seemingly ageist underpinning to this, wherein researchers and collectors of data and data analysts may not sort of consider older people as being able to be victims of abuse, especially varieties of abuse such as sexual abuse, wherein we know that sexuality is deemed only something for those below 65 or 60. And so, as Anastasia said, these experiences are not considered, and they're not sort of built into the survey rationale or methodology or collection for data collection purposes. I think that's really key is the lack of, as we see with all, really unfortunately, all facets of attention around older people as victims of abuse and violence, wherein there is a lack of attention both from policymakers and the general public, and a lack of understanding. I think unfortunately that is also the case in data collection purposes. And as they said, sort of that leads then to people that haven't been trained to understand these experiences, this wide range of experiences of older people, and therefore not equipped to capture the data. I think another problem is that you're not having the voices of older people, as older people are generally not being the researchers themselves. They're not capturing the data themselves. So those voices aren't available or accessible in order to widen methodologies, widen data collection practices or rationales. And so the experiences and the voices of older people in data is therefore deemed non-essential or not relevant.
Thank you. So the next question is, and it's like, Danny, I'll get you to ask this first this time. Why is accurate data important to understanding the abuse of older people?
I think, as you said in your introduction, Nick, without accurate data, we really have no idea what's going on in trends, in prevalence, in practice around the abuse and violence committed against older people. And this is key from a legislation and policy making perspective, wherein if we can understand specific trends or notions that are happening to older people, actions that are happening, perpetrator actions and victim experiences through data, then we can more easily help alleviate or intervene in those actions and help victim survivors. Unfortunately, the last true UK prevalence study was carried out in 2007. That is almost 20 years that we've gone without prevalence studies. We're heading towards 20 years without a prevalence study. And we obviously have means in which to capture data, but without sort of a government focus on UK-wide data and all the facets of abuse and violence committed against older people, we really are still walking around in the dark very much. So I mean, I'm obviously biased because I work in a data and research and policy role. As if you ask someone in the communications or frontline side of the organization, they may say that data is not that important. So that's a caveat, obviously. But I think from policymakers, researchers, academics, we'll all understand that sort of without understanding what's happening on the ground and what the data can tell us, then there's really no way to move forward accurately and effectively, because yeah, we're just grasping for something that we don't know about.
Anastasia, why do you think it's important?
Yeah, of course, I might also be biased, as Danny said, but although I think it's quite logical and rational, like we need accurate data to first understand that whether the problem exists and where it exists, and we also need accurate data to understand like how much resources we needed to address the problem. For example, if we want to know the prevalence of violence in particular groups, we need data to like on trends of violence to understand whether particular policies and interventions are working or not, and whether we need to whether they can be continued, whether again the resources need to be spent on them or something need to be changed. We also need accurate data again for even subgroups of older people to understand whether targeted interventions are working or not. For example, distributions of violence in older people against people of different ethnicity and other factors. We also need data to understand what kind of support all the people who experience violence and abuse look for. For example, whether they are more likely to address health services or police, and what kind of support they receive against, and again support they receive with these issues. And again, it's needed to understand the effectiveness of the existing measures. And so without accurate data, we kind of very blind. And again, as Danny well said, it's like we're being in a dark environment without seeing whether what's happening and whether something is working or not.
Thank you. You've sort of touched on this already, Anastasia, but I'm wondering what are some of the other issues around the current data and abuse of older people that we need to overcome?
So in terms of so kind of one of the issues again is as was mentioned, lack of data and lack of data sources on violence and abuse in older people. So it's a crime survey. Luckily, crime survey has started including older people now, but it's only this year, so we don't know anything about the previous trends. But in general, there's a lack of data sources what we can use to measure violence against older people. There are also issues with even if their data sources collect information on violence and abuse in old age, there are problems with inaccuracies because of underreporting and underrecording. And to be fair, these issues might exist in other age groups as well, but there are specific reasons for older people and maybe more prominent. For example, for issue of underreporting, because from some sources we know older people are more likely to experience violence in domestic settings, like from their family members or intimate partners. They might be less likely to report this information to the services, so we wouldn't know about it. There is, again, as mentioned, about kind of disbelief that other people will experience violence, and there's issue of under-recording as well by the professionals who deal with older people as well, because they might be less likely to ask about it. So there is also an issue of under-representation, I would say, and again, because there is even in older people is a bit less some smaller number of people potentially in the surveys that collect data on violence. But if we want to look at more specific details, such as, for example, violence in older age by ethnic minority groups or by people different sexual orientation, it's even more difficult to see these problems, because it's even smaller sample sizes, so we can't really say anything based on it often. So maybe possibly more data need to be collected from these groups as well. And also, one of the issues is lack of data from institutional care and social care, which is really relevant to older people, but there are basically no sources of data on this.
Right. And Danny, what do you think some of the current issues are with data on abuse of older people?
Yeah, I think Anastasia basically summed everything up there. I can't really add that much more. I think if, as I said, if data is collected, say we get data by the ONS collected, a lot of time it's not disaggregated down into age ranges or age brackets. It's very hard, therefore, to delve deeper into illuminating the experiences of older people. As Anastasia also said, we do have a real lack of data understanding experiences in care homes. and in nursing homes and other institutions like that. I appreciate the ONS have looked into this recently and have done some work with Hourglass in order to utilize our data and data from NHS Digital to try and find out more about this. But the ONS have decided that because of ethical considerations in asking these questions, that there is no plans at the current time to bring this data into the crime survey for England and Wales. So sort of we're stuck there really. I mean, as Anastasia said, the use of age caps that we've seen up until recently in data collection, where we haven't seen the data actually getting collected, has meant that we're really starting from a low level still now with data collection and trying to sort of get as much information and understanding from the lack of data that we have. I think a lack of regularity in and public accessibility in accessing and posting data by key organizations and government organizations and the police in general, police forces, CPS, is a real problem. I think the freedom of information legislation as it stands makes it very hard in many cases for researchers to gain access to data wherein, as Anastasia said, we may be dealing with a small number of reported cases. And because of the lack of reporting or the lack of recording, it's then very hard to then access that data from freedom of information sources. So I think, as Anastasia said, there's a vast problem in recording, reporting, and as we said earlier, lack of understanding by data collectors in older people's experiences. But there's also fundamental problems in the freedom of information legislation in order to access the data, the continued rumblings from age caps, which may now have been released, but sort of still haven't enabled us to get the data up until only recently. And the fact that if data is available, it may not be released regularly or publicly, or the data may not be broken down by age brackets and therefore easily deep diveable into understanding the issues that are facing older people.
We've had a couple of questions come in on the chat, so I'm going to jump to one of the first ones now. There's a lot of data available about local authority safeguarding provided by NHS Digital. How much do the speakers use this, and how accessible do they feel it is? The many redesigns over the years appear to me to obscure a lot of the issues now. Do either of you have any thoughts on that?
I would say I haven't used data from local authorities on safeguarding. I mean, I have experience of working with NHS, NHS, I think it's not NHS England, and it was data from hospital episode statistics and also looked specifically at safeguarding information. And it's quite a tricky and challenging process to get access to the data. The only reason why I was able to get it is because I had a secondment with DHSC. So, especially again, the part of the problem is how difficult it is sometimes to access information. And another issue is also actually in terms of safeguarding specifically, the variable that I really want to do was a safeguarding variable in the emergency care data set, but it was hidden because of and was not available to people who use NHS England Trust Research Environment. And the reason is because the quality of collected information was very low and they didn't have enough data. So again, it's kind of like a vicious circle. They don't have enough because there's no kind of good information, we can't really make any conclusions. We can't show the problem, extent of the problem, and that's why maybe the government doesn't see as a priority as well. So yeah, sorry, it's very complex answer, but yes, kind of safeguarding information really could be very useful, but unfortunately is either not available or not necessarily of good quality.
Thank you. Danny, anything to add on that one?
I can't really add more to that, Nick. That was exactly.
Perfect.
Sort of what we find, yeah,
Mm.
it's hard to access data, and then the data may be of a poorer quality, or there may be a lack of actual cases to look into, because as we said in the last question, because of all those very reasons.
All right, Danny, do you want to do the next one? Does any survey now collect information about domestic abuse for people over the age of 75?
Not off the top of my head. Anastasia actually might be better placed to answer this than me, because you may be working around these. Obviously, we're not. This is sort of a topic that obviously we carry a lot, but a lot of time we try to use our own data and then broaden out into other data. So Anastasia might be more up to date on any newer surveys.
It's not a new survey. It's adult psychiatric morbidity survey, or mental health surveys, also known as. So it's the data source that is like the data is collected by NatSen, and they do collect every 7 years, I think. They collect information on obviously mental health, but they have quite good questions about violence and specifically domestic abuse as well. So that's actually what we used, and they don't have upper age limit, which is really good. So you can look at information about domestic abuse in this age, in age group. It was not very like accessible for people, but they recently changed the regulation. So I think now it could be easier to get access to the data. You need to like I can't just exactly say how exactly it needs to be done, but yeah, that's if anybody is looking at, worth checking adult psychiatric morbidity survey.
Great. Because a few years ago, was it the National Crime Survey started collecting data for people over the age of 75. So I'm wondering if that, but it's still too soon to really have those numbers in to be assessing those, isn't it?
Yeah.
Okay.
Yeah, I think as we said, sort of, because it's been so soon, the data isn't there, and from the crime survey, hence why I didn't mention it.
Yeah. No. So that's in future we will have a bit more of a picture, but at the moment, I know that they lifted that cap during the pandemic, so they had to delay that as well. So we've had a couple more. We can go back to the other questions, but there's a couple more in the chat. One more I'd like to come to anyway. How should we as a domestic abuse sector come together to influence government on the importance of data collection? Given that most perpetrators of domestic abuse do not touch the criminal justice system, something which is a bigger subject, but for older victims, it's a particular issue, as many do not feel they can report it.
Big question.
Yeah.
Big question.
I answered the question in the chat, but yeah, sorry, Danny.
Yeah. Okay, no problem.
Oh, sorry. Who is going to answer?
Sorry, go on.
So yeah, well, one of the ways well, in the center, I know in the consortium, we're trying to influence is the government, I guess, is by showing the impact of violence in terms of health impacts, and actually that violence is like independent abuse, an independent factor that makes people's health worse. And that's why the studies I've been doing involved is they also showing the impact of course, violence in older age, and that it's independent from other social factors. So this is basically to show the costs of violence, that it might be more expensive to deal with the consequences of violence later on than to try to prevent it or address it at the early stages. So from that kind of more, I guess, pragmatic, it's one of the pragmatic ways to show why it would be important to improve the data collection, so because it's one of the first steps to obviously prevention measures.
Danny, there's another one coming, and I think you might be placed to answer this. And it's from Rob Anderson. To what extent does Hourglass collect and analyze the information from calls to the Hourglass helpline, while a sensitive issue could more be made of this data?
Thanks, Rob. Yeah, definitely. I think as I mentioned earlier, we've just worked with the ONS to release some data from 22-23, which should be available. I think if you type in Hourglass NHS Digital Data ONS on there. Of course, we try and analyze every year as much data as we have. I'm sure you understand the difficulties with data collection via the helpline, wherein we are talking to generally victim survivors or concerned others, their family, their friends at the time, or very close after an act of abuse has happened. In many cases, the data that is collected or can be collected may not be as robust as data that collected down the line, which is unfortunately an issue with the collection and use of the data that we collect. But with that in mind, it's still a really good, we feel it's a really good avenue to collect key real-time victim survivor experiences and data. And yeah, we analyze, break it down into types of abuse, perpetrator victim relationships, the number of perpetrators, victim's age, victim gender, victim's location, what the victim was looking for, all the concerned other was looking for when they phoned up, what support could be available, what support was signposted, and actually other varied things that turn into more niche aspects, especially around economic abuse, as in whether a house was coerced away, the amount of money that was stolen or scammed or frauded, or whether something was a predatory marriage case. We have a number of different rationales behind the analysis, apologies, of our data, but there's still more to do. Really, we are currently in the middle of a process of strengthening the data and hoping to utilize it more. Obviously, we utilize it a lot in our policy making, but ideally, we want this to be an ongoing relationship with the ONS and other members of the VUL community and the DA community, where we're all sharing data. I mean, that sort of could maybe answer a bit of the question above too, where we all need to share data more and understand sort of the use of data more to help the government understand. So yeah, thanks, Rob. There's still a lot more we can do, but we certainly do feel it is we do collect and analyze the data quite a lot, but definitely we can have a conversation offline around that as well if you sort of want to see some of our recent data. So just to mention just something that I've also just remembered. A couple of years, the last couple of years, we've had a few academic researchers do data around the Hourglass helpline. Sylvia Dominguez from Birmingham City University in the last couple of years wrote a paper around analysis of elder abuse utilizing our data. I will try and find that and link that into the chat if people are more interested.
All right. So the next question, and I'll go to Anastasia first. And again, there has been partly covered, but there's probably more to explore. What current means are there to uncover data about the abuse of older people?
Yes. So one of the ways, I guess, is to be kind of more creative in that sense and think wider in terms of what information we can use. So that's why, for example, I used the England longitudinal study of aging, which is not the focus not necessarily on violence, but they have asked questions about violence, and of course because the population, the participants are age 50 plus, so they kind of fit quite a lot of them in all the age group as well. So and also I guess other sources like administrative data sources, and the purpose is not to capture information about violence, but they can be used to understand the prevalence of violence as well, at least in people who use the services. And very also useful, I guess, when when there are collaborations between different sectors, for example, between health and police sectors, and they link data. And that's the example in Wales. They did it in Public Health Wales. So then you can look at the data from two different words use and see where there is overlap and differences, of course. So also collaboration, engagement with the stakeholders such as ONS, of course, is really important because the ONS is responsible for crime survey in England and Wales, and they, I think they're doing quite a good job in terms of actually responding to the feedback. So but that probably was a reason why they removed the upper age limit for in the self-completion part in response to what academics and other sectors said. And now they also are considering to collect data from care homes, I think, as well. So yeah, that probably would be the main ways.
Right. Danny, anything to add on the current means to uncover data on abuse of older people?
I think Anastasia smashed that one out of the park, really. Obviously, we're trying to utilize the same means of data, so yeah, I can't really add much more to that.
Great. Well, there's another question coming that's directed to you, Danny, that you mentioned the lack of older people's voices in research. But for researchers, university ethics committees will be extremely wary about approving studies which involved service users who had experienced abuse. Does Danny have any suggestions about successful ways of doing this? Could Hourglass set up service users panel to advise and scrutinize research proposals, or a group for researchers interested in this area? It is very hard to find out what else is going on.
Thank you for that question. Yeah, it's a very difficult one to deal with, wherein, as we said, we are working with victim survivors who may have very recently suffered horrendous acts of violence, neglect, or abuse, and to work with them in a way that is trauma-informed but doesn't really revive their experiences, that doesn't bring up their experiences again. And you're right about the ethical issues that some academic boards would have around this. I think you're right, a research group, a lived experience group, I think lived experience panels are one of the easiest ways to get older people's voices and other victim survivors' voices in as key users and creators and curators of research projects, and I mean much of the work that we do in general. Allowing older victim survivors to have a chance to scrutinize research projects, to suggest improvements, to identify other means of data collection that we as researchers who are not older or who may have not experienced neglect or violence or abuse may be unaware of, I think is the first step, really. I think it's hard for me to bring up other steps that may be useful when this first step is so lacking anyway, the use of lived experience boards and lived experience voices. I think from sort of the growing use of lived experience boards, and definitely Hourglass should start incorporating lived experience boards and lived experience panels around our policymaking and research more, and indeed plans are afoot on that. I think sort of what we then find out and understand from those lived experience voices can then inform other means that we may, at the moment, because we haven't done enough work around understanding and curating data collection through the input of lived experience voices that we're still sort of in the dark about. I think that's key. I think luckily the sector has, in all aspects, seen how important lived experience voices are, while understanding that there are still ethical concerns about working with victim survivors, wherein we have to make sure that victim survivors are supported in all ways, that all of our work is trauma informed, and that we're not bringing up and forcing them to face their abuse in ways that is not supporting or trauma informed. So yeah, I think it's a really good idea to start working with boards more and panels that are full of lived experience voices. But again, we have to be careful with that. We have to be clear. But yeah, brilliant, really good. Sorry, I rambled on that one.
No, that was good. Anastasia, you don't have to, but is there anything you want to add to that?
I personally haven't had experience of getting ethical approval for working with older people. We do have lived experience groups who work with in the consortium. They're not necessarily only older people, but also victims survivors of violence. I think it was partially facilitated by the fact there were existing kind of networks and engagement with a third sector and other like lived experience that maybe also sort of worked with other academics before, so that was helpful. But I think it's still worth trying as well, like getting ethics approval and just probably trying to sort of explain how you're going to address potential issues. Somebody said it's a very protective voice from stakeholders of all the other services. I think that's actually part of the problem is, again, in some way I see it as ageism as well, because it's like sort of seeing old people as in some ways children and or somebody who is not able to maybe needs to be so protected. And of course it's understandable, but at the same time, like these people need to also probably want to and need to be heard. And I'm not sure how to address this problem, but we certainly need to sort of try, I think.
And that makes sense. The next one's from Mary Harrington. I think I know the answer, and I'm not sure either of you will, but I'll ask it anyway. Every year, Jess Phillips reads out in Parliament the names of women killed by partners or another DV, domestic violence. Does this include older women who often succumb to neglect rather than physical violence?
I don't think it does it? Because
No.
it's from the femicide census.
Really
I'm
confident
looking through the femicide census. Yeah, I don't think it does at all, unfortunately. Which again, Mary, that sort of illustrates the extinguishing of older victims' experiences.
I mean, I'll add to that, when Jess was the shadow minister, we did meet with her a few times, and she certainly understands that that's part of the picture. But no, in terms of what she reads out, no, that's not part of it. I'm pretty, yeah, I'd be 90% confident.
Not that it's not worth looking at the feminicide census, just the ad, they do have some small amounts of data around age within it. But as a piece of work, it's always worth sort of mentioning as something that is illuminating to murdered women's experiences.
Yeah, that's good. So there's a few more comments in the chat, but we don't seem to have more questions coming in as yet. So please do keep them coming in. The one question I've still got from our prepared ones is, what next steps need to be made to improve data collection in this field? Danny, do you want to jump in? And then Anastasia.
I mean, basically, it's a lot of things. Firstly, Hourglass has been calling for a strategy in conjunction with the VOG, the Violence Against Women and Girls strategy, that focuses purely on older people and their experiences as victims and survivors of abuse and violence. So there needs to be legitimate government attention on sort of overarching fundamental issues of abuse and violence committed against older people before we even start digging down into data. But within that, sort of, there should be much more of an impetus on institutions, government institutions, police forces, CPS to have a one data collection. I mean, we didn't talk about this, unfortunately, in an earlier question about the issues, but one of the issues around collecting crime and justice data from the police via freedom of information is that every police force seemingly utilizes a different data collection, a different way to collect data. Some may collect broad age brackets. Some may have data that will allow you to see specific ages and release it. Hourglass would like to see a one-stop shop, really, an overarching data collection system that all police forces utilize that allows for age ranges, age brackets to be illuminated, and older people's voices to be heard, rather than now not having access to that data. So I think that's sort of key. That's sort of two of the things we're asking for. Obviously, age caps in other surveys, especially around health, especially around abuse and violence, being stopped. We want to see surveys with no upper age limits. We want to see more lived experience voices in research and data collection prospectuses and methodologies, wherein researchers and data collectors have sought out victim survivor voices to help illuminate how best to collect that data with these victims and survivors. I think. Sorry, Anastasia, I will come back to this question a bit more, but I've just Anastasia, if you could sort of hop in.
Yeah, do you want to jump in?
Yeah, sure. That's very actually comprehensive answer, Danny. I want to, in terms of, yes, of course, remove for the surveys, removing upper age limit if such a limit exists, but also for health service, I know as well, to actually collect data on violence and abuse, because many of them don't do this. And given that violence has been pronounced like a public health problem many years ago now, so it probably needs to be considered as one of the social factors that of course affects health. And then we would get more information on violence effects on health and in different social demographic groups, including older people. So another thing is also probably collecting data from other settings. Like most of the surveys are collected from households, and as I mentioned already, that more data need to be collected from. Actually, data need to be collected from care homes, and potentially also even other settings such as prisons or from homeless people as well, if possible. Also education and training among more education training among the professionals who deal with older victims survivors of violence and abuse as well. So, and that includes health professionals and police as well, and also just raising awareness about that these things can happen. So let's say, for example, one of the studies in which we use adult psychiatric morbidity survey, we demonstrated the impact of violence and abuse on depression and anxiety. So that can be healthcare professionals need to be educated that one of the reasons why all the patients can present with these conditions is because they might be potentially victims of violence. But also in terms of how to communicate with older people, older patients, or other service users as well, or how to ask them about it as well. I guess also in general, raising awareness, or raising in the general population, educating people about these issues that they might affect older people too.
Right, thank you. Danny, is there anything else you wanted to jump back to?
Yeah, I think Anastasia actually sort of hit a lot of those points. But I think sort of maybe there should be some statistical guidelines and guidance developed around how best to deal with older people and collecting those voices. As Anastasia said, a lot of the time we need to illuminate those victim survivors as much as older people as a victim survivor group are understudied, under-researched, and misunderstood. There are within that group older men as victims, especially where data, even if data collects it, may not, because of and older LGBTQ plus older minority ethnic victims, wherein the underreporting is even more, and the misunderstanding and the lack of understanding by data collectors of how to deal with these experiences is even more prevalent. So a focus again needs to be on those victim groups as well, and how best to work with those victim groups too.
Right.
But Anastasia sort of hit some really good things with education. You're right, and aspects like that, and training, especially where we need policymakers, data collectors, researchers, all better, the general public, everyone, to better understand that sort of older people are a legitimate victim group of abuse and violence, and that we can't forget about them. They've been sort of misunderstood, and well, not even seen as a victim group for so long, really, that has to stop.
Another question in the chat from Sam. In relation to the earlier question around whether the list of names read out includes those who have died of neglect, do DHRS currently include those who have died of neglect related to domestic abuse? Do either of you?
Sorry, Nick, would you repeat that question?
Okay.
I can't actually see that in my...
So it's further up at Sam S. So it was posted at 10:41 in the chat.
Okay.
In relation to the question around whether the list of names read out includes those who have died of neglect, do DHRs currently include those who have died of neglect related to domestic abuse?
Do they?
Is this one we may need to go away and come back to?
We may need to go away and come back to.
Okay, let's put a pin in that, because that is quite an important question. And then I've had another, Rebecca, thank you for sharing your personal story. That's incredibly heartbreaking, but thank you for sharing that.
And they should do, because
let's come back to that one.
Okay. Yeah.
No. So
I believe
Rebecca,
they do, but
okay, they think they do. Okay, let's confirm that. We may need to send a message around afterwards to confirm that, because people will want to know. So Rebecca, you've put a question as well now about your mother's case and how agencies, including Court of Protection, deny the existence of abuse of older people / women. The Home Office has told a local authority to conduct a DHR. They are very reluctant to do this, as they will have to admit abuse. I found the system was impossible and negligent at every level. The police recognized coercive control but actively ignored it, even putting it in writing that they did not need to protect an older person with dementia. How can our case study be published and used to help change? I mean, I can have a go at this. I mean, we're always looking. One of the biggest challenges we have, so obviously we want data, but actually often we also need to tell the stories of what's happened, and it's not particularly easy. A lot of victims, there aren't many victims of either, sadly, and those that are generally are not that comfortable talking about it. But we are always trying to highlight it and promote the cases so we can talk about what happened, and where there's been shortfalls or where there's perhaps been a knowledge gap by law enforcement or by other agencies, we can highlight that. Not with the aim of sort of, having a go, but in the case of this can't happen again, we need to try and make sure that we've learned from earlier cases. And when we do publish anonymous case studies from time to time, and if we can get a name case study, even better, but they are rare. But obviously, I mean, again, this is something we can pick up offline, Rebecca, but we're very keen to take action on that and try and raise awareness through case studies where we can, because it does make a difference. Don't know if you're going to jump in on that, but so there's another question about NHS Digital come in. So they're concerned that the previous answer didn't mention this as a source, NHS Digital. Do we know that many cases don't reach charging standards for the police, so they won't appear on the crime stats. Local authority info provides an indication on the numbers of abuse cases that are dealt with by local authorities, which will never be acted upon by the police, so aren't the safeguarding figures from NHS Digital. Social workers are all required to beaver away and record information about abuse cases. which all get recorded in these figures. Safeguarding adult reviews where the adult has been seriously harmed or killed as a result of abuse are also really informative. As Michael Preston showed in his study of SARs around self-neglect. So there's a bit of a comment, but I'm wondering if either of you wanted to follow up on that at all.
I can't see the question, sorry.
It's in the question and answers. It's an anonymous.
Right. Sorry.
I can post it in the chat if that helps.
Oh, okay, I found it, sorry.
Yeah, okay, all right.
Just to clarify, this is on the safeguarding information that NHS Digital, I think they already published the figures, right? They don't, actual figures, they are available, I think. It's just what is refers to.
I believe that's the case,
Okay.
yeah.
I mean, I think this information can be very useful, actually. Like, I've looked at it for sure for references. We haven't used them, because obviously for the research I'm doing, use the data collected. So, this is already actual figures, but I do feel like they can be quite useful to understand the extent of the problem. And I have used them to, at least for, as I said, for references and something to compare this as well over the years.
Okay. So there doesn't seem to be any more questions come in on that or anything else. So I guess now it'll be sort of over to concluding remarks, if you have any. Anastasia, do you want to go first?
Concluding remarks.
Yeah, if you have.
Yeah, so, well, in terms of improving this, I think actually Hourglass for organizing this webinar. I think it's really important for raising awareness. It's one of the ways to do it, and for sure. And I'm kind of a bit. I think things are moving in a bit like more positive direction. Certainly with the crime surge for England and Wales. And hopefully, I'm really hoping they would start collecting data from social care as well. It's still there are many challenges, and I'm not so optimistic in terms of like timelines and when we would be able to address these challenges. Because I think so. One of the issues we're facing is a aging population, so it means more and more people, more and more older people, and also potentially more victims of survivors of violence and abuse. So, and for sure, given that things need to move quicker, both in terms of data collection and in terms of policies. But it's just, yes, I'm also, I think there is in terms of in the academic environment, I know there is a more interest to the disease problem. Before there was more studies, like more qualitative studies, and now people are actually trying to look at the data and look for data sources. I know there is research at UCL and Exeter University. So yes, hopefully things will progress. As I said, not as optimistic. I don't think they're progressing the right speed, but as long as we're engaging with stakeholders and engaging with policy this collaboration between academics, charities such as Hourglass, and policymakers are very crucial, I think.
Thank you. Danny, any closing remarks?
Yeah, just to come back to that question about sort of NHS Digital and sort of Section 42 and safeguarding figures. Obviously, age brackets are available as to the number of Section 42 inquiries that occurred on a certain age, but there's still huge gaps that they don't allow. We can't see the data wherein to see what sort of abuse type that linked to in the age, the location, etc. This is sort of the information that is key that we need to know. We need to sort of see all these rather than being sort of gaps in our understanding of sort of safeguarding inquiries related to certain ages and certain age brackets. As for concluding remarks, I, along with Anastasia, are, I'd say, mildly optimistic that we are seeing movement, but as Anastasia says, it is far too slow still, and far too lacking in understanding of older people in general and the abuse of older people, let alone data itself, data collection. Have been some interesting in the academic community focuses recently, and an influx in sort of focus on, especially around older women, experiences and sort of practitioner understandings of abuse, as well as a renewed focus on economic abuse, which is really positive. As I said, sort of a lack of understanding and focus on other victim groups that are also older people, as we've mentioned earlier, men, minority ethnic, LGBTQ+, travelers, rural people that live in rural environments. Data around these groups is really lacking. And although academic researchers are focusing more on data involving other people, and we are seeing movements, as you said, with the removal of age caps, and ONS working with us, for example, when NHS Digital to shine more of a light on older victims' experiences. As I think we've hopefully tried to say throughout all this, there are huge and massive gaps into our understanding because of the lack of government focus on data and older people, the lack of national prevalence studies, the lack of focus on experiences in care homes and nursing homes, the lack of a focus on perpetrator studies and data around perpetrator, and how sort of understanding risk factors perpetrators commit abuse towards older people, aspects like that. These are huge gaps that other parts of the vulg sector and the domestic abuse sector and violence and abuse sectors may not suffer from anywhere near as much as we do, focused on abuse and violence committed against older people. So movements are happening slowly, but obviously this is not good enough. As Anastasia said, I think as we've tried to say as well, ideally, any new government will have looking at the abuse of older people, abuse of violence committed against older people as a priority for the next administration. Unfortunately, I don't think they will. And this is sort of what we need to, as we've all said in the questions earlier, awareness is really, and data is key to that. As we've said, data is key to the understanding the trends, the needs, the interventions, the actions needed to feed into awareness. Without the data and the awareness, we are still, as we said at the beginning, fumbling in the dark far too much, and that needs to change.
Well, thank you. Well, thank you both for today's webinar. I think that's been a really useful discussion. I've been really pleased with some of the questions that have come through. I think we've drawn out a lot of important information. The next one of these will be, as you'll be aware, there's now a general election campaign. So we'll be having a series of webinars in June. The first will be just after World Elder Abuse Awareness Day, and it'll be talking about the launch of our campaign, Older Age, Tomorrow's Hope, or Oath. And the goal there is to end abuse and neglect of older people by 2050. And then we'll be talking about what we think needs to happen immediately to get us on that journey. We will also be doing an analysis of the political parties in Westminster and their manifestos. We don't, obviously, we're an independent charity. We do not endorse any political party or organization. We do, however, assess policy and look at how strong it will be in protecting older people. So we'll be doing an assessment of those manifestos, looking what's positive and then what we think we need to see going further. And we hope to get some representatives from the main political parties to actually speak to us to talk about our vision for a safe and aging society and what they would do to progress that. So we'll be sending notices out about that in the coming weeks. We'll be asking people to sign up to our Oath campaign, the place to support our vision of a society free of abuse and neglect of older people by 2050. So please go on our website and sign up to that. And you'll be seeing a lot more about that on our social media channels in the coming days and weeks. Other than that, thank you all for coming, and we look forward to seeing you again in our next webinar. Bye.